Welcome to the YouTube channel, Dr. Mai, sharing medical knowledge. We are thrilled to have you here. Welcome to the YouTube channel, Dr. Mai, sharing medical knowledge. We are thrilled to have you here. If you enjoy the content, don't forget to subscribe to the channel, like, and comment below the video to support our channel's growth and enable us to bring you more valuable health information. Today's topic is an important one: whooping cough. What is whooping cough? Whooping cough, also known as pertussis, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. It primarily affects the lungs and airways, leading to severe coughing spells that can last for weeks or even months. The infection is characterized by a distinctive whoop sound made when the infected person breathes in after a coughing fit. While it can affect individuals of all ages, whooping cough is particularly dangerous for infants under 6 months, who are at high risk of severe complications and often require hospitalization. How is whooping cough spread? Whooping cough spreads through droplets in the air when an infected person coughs or sneezes. These droplets can be inhaled by others nearby, leading to new infections. It can also be transmitted by touching surfaces contaminated with the bacteria and then touching the face. The infection is highly contagious, and an infected person can spread the bacteria from just before the onset of the cough until about 3 weeks into the coughing phase. Antibiotics can reduce the contagious period to about 5 days after starting treatment. Signs and symptoms of whooping cough. The symptoms of whooping cough typically appear in stages. Initially, they resemble those of a common cold: runny nose, sneezing, mild fever, dry cough. After about a week, the cough worsens and enters the paroxysmal stage, characterized by severe coughing fits, a high-pitched whoop sound during inhalation, vomiting after coughing, exhaustion after coughing fits in infants, pauses in breathing. The severe coughing fits can last for 10 weeks or more, hence the nickname, the 100-day cough. When to see a doctor? It's crucial to seek medical attention if you suspect your child has whooping cough, especially if they struggle to breathe, have blue or purple lips, cyanosis, have severe coughing fits, are under 6 months old. Call an ambulance immediately if your child has difficulty breathing or if their lips start to turn blue. Diagnosing whooping cough. Doctors often diagnose whooping cough based on the symptoms and the characteristic whoop sound. To confirm the diagnosis, they may perform a swab of the throat or nose to test for the presence of Bordetella pertussis. Blood tests. It's important to note that if the child has been coughing for more than 3 weeks or has taken antibiotics before the test, the bacteria might not be detected. Treatment for whooping cough. Treatment depends on the age of the patient, the severity of the symptoms, and the duration of the illness. Key points include: 1. Antibiotics. These can reduce the contagious period and are most effective when given early in the course of the illness. 2. Hospitalization. Infants under 6 months and older children with severe symptoms may need to be hospitalized for close monitoring and supportive care. 3. Supportive care. At home, ensure the child gets plenty of rest, fluids, and small, frequent meals. Home care tips. Taking care of a child with whooping cough can be stressful. Here are some tips to manage care at home. Provide small, frequent meals. This can help prevent vomiting after coughing spells. Keep them hydrated. Offer fluids often, such as water or breast milk, formula for infants. Create a smoke-free environment. Avoid exposure to tobacco smoke, which can exacerbate symptoms. Seek support. Don't hesitate to ask family and friends for help to manage the stress and get some rest. How to prevent whooping cough. Immunization is the best defense against whooping cough. The vaccine schedule is as follows: infants, at 6 weeks, 4 months, 6 months, 18 months, and 4 years. Adolescents, a booster dose at 12-13 years. Adults, a booster dose for new parents, grandparents, and caregivers of infants, and for pregnant women during the 3rd trimester, 28-32 weeks. Key points to remember. Whooping cough is especially dangerous for babies under 6 months of age, who often require hospitalization. The infection spreads easily, making it important to keep infected children away from school or daycare until they are no longer contagious. Immunization is crucial for preventing whooping cough. Seek immediate medical attention if a child struggles to breathe or has blue lips. Thank you for watching and for supporting Dr. Mai, sharing medical knowledge. Don't forget to subscribe, like, and comment below to help our channel grow and to stay updated on more great health topics. Stay healthy and take care.